So, as Abby said, I'm Dr. Wynn Nguyen. I'm an optometrist with a special interest in vision rehabilitation, particularly in the areas of learning disabilities and brain injuries. So, I'm very excited to share with you today the world of vision therapy and what it entails. Now, firstly, what we think about when we think of vision is people usually think of the phrase 20/20. So 20/20 refers to how well you can read a chart or you go into the eye doctor's office. What is lesser known is how easy it is to pass that chart. So vision may appear perfect on paper, but clear visual acuity, which is what 20/20 is, doesn't actually mean perfect vision. So if you look at this first line here, you can see like this with splotches and you can still see 20/20. A person can reverse letters and still see 20/20. You can see doubling and still see 20/20. You can have trouble even processing the letters at all and still see 20/20. So that's why we need to dig deeper. In reality, all these things and more have to go right in order for you to see. It's really like a neural network. So information is input, then all these things happen, and the result is that you've processed vision. That's the output. Now, if any of these hidden layers become messed up, your output may be inaccurate. Or if any one of these wires get lost, you may need more energy from another wire to function. This can cause discomfort. And that discomfort usually is hard to put into words at a doctor's office. So that's where we try to help. That's where this brain injury vision symptoms checklist comes in. So if any of you have experienced going to the doctor's office, having all these horrible things happening in your day-to-day where they're just not like what they used to be, and you can't really describe it, a vision symptom checklist like this can kind of try to help you put into words. So we try to look at this to see how a brain injury is affecting your vision. We'll look through some of the symptoms together and what they mean. And if any of these resonate with you, I encourage you to sit down with this full checklist yourself. I know those little words are teeny tiny, so I'm going to blow them up right here as we go through the checklist. So the first one that we're going to look at looks at near vision being blurred and not clear, even when you have lenses on. So this is a very common symptom after a brain injury, and it may be that the focusing muscles in your eyes have weakened. And that can be because of a number of things. You could have your glasses already made, perfectly made, and you could still have imperfect vision. And that may be because your tolerance is lower than what it was before. You may not have the capability, even though that you never need glasses before. It may seem that you suddenly need glasses now because all of a sudden what you could handle before isn't as clear anymore. You could have eye fatigue or very tired eyes after using your eyes all day. This typically means that you're working harder to use your eyes, and either it means you're undercorrected, meaning that your prescription is out of date, or you're supposed to wear reading glasses, but you're not. Or if after all these things are fixed and you're still having issues, it may be that your capacity for tolerance is much lower now. So sometimes a head injury causes you to maybe appear to need sudden glasses. But in reality, the ability to see was because all the systems in your eyes, like in that hidden layer, were working in synergy. Now, when one part of that system breaks, you have to work harder to use the other parts of your system to get the same result. So in order to engage the muscles, the nerves, the focusing fibers, basically all the things that were second nature before, you now have to work much harder to see them, to use them in order to see. So this is bound to cause fatigue and that strain by the end of the day. Now, if you ever notice that you're getting double vision, especially when you're tired, this can either be due to muscle damage or nerve damage. Either a nerve has become paralyzed or a muscle has become weakened. Most times, nerve damage is more permanent and not trainable. In this case, we would use special glasses, like crutches, to hold the eyes together. In some cases, it is trainable. But now with muscles, in most cases, it is trainable. And that is where therapy can come in. We try to get those muscles working almost as well or just as well as they used to. Now, if we are having normal indoor lighting and that is even too uncomfortable and you're noticing too much glare just from like fluorescent lightings at the office or inside your home, maybe that your tolerance is lowered. Where you were able to tolerate minor imperfections in your vision in the past, like a little bit of glare or a little bit of aberration, you may not be able to now. You could be sitting in the same office as always, but suddenly that head injury becomes unbearable. Now, usually where you could suppress and tolerate that glare before, you may not be able to anymore. So with therapy, some of these thresholds that were lower can be raised. But of course, that takes time. So there are special tints and lenses that can be used to help in the meantime with that. Now, if you feel like after an injury, your eyes feel dry or they sting, usually it could be hormonal changes. Hormonal changes are very closely linked to dry eyes. After a brain injury, it's usually linked to stress hormones. What is more mainstream, though, and it's more widely known, is that dry eye can come from changes in estrogen. So it's widely known that menopause causes global dryness everywhere in the body. So most of the general population, dryness can onset at the age of menopause. But if you happen to have a TBI around the age of menopause, dry eye symptoms can be compounded. Now, where we can't always change the hormones, stress hormones can be hard to change. Changes in hormones after menopause can be hard to change. There are many more things that we can do to treat the dry eyes itself. Now, it's important to understand that dry eye is a progressive disease and it can get worse if not managed. Now, this can be a talk all on its own, but for now, I will say that it's important to have that assessed just to see where all the glands that give you tears that provide you with clear vision on the front surface of your eyes, the ocular health portion is assessed as well. Now, if after an injury you're noticing some clumsiness or that you're misjudging where objects really are, you may have poor depth perception. Now, it may be long-standing, or again, that tolerance has been lowered. Or you may now be shutting off or suppressing one eye, meaning that your two eyes aren't able to work together to perceive depth. This can throw off a lot of things in your day-to-day life. For example, you need depth perception to walk down the stairs, to know where you're stepping and where you're going to. You need to be able to judge the space between you and the car in front of you when you're driving. You also need to know where and how far the wall is in front of you so you don't bump the door frame when you're rounding the corner. If you're picking up any jars or anything from a counter, you need to know how far it is to grasp it right away. Otherwise, you may be missing it. So these are all things that can occur after a brain injury. Now, when you are avoiding crowds or you feel like you can't tolerate visually busy places, for example, the supermarket or maybe concerts, you may have poor central peripheral integration. So where poor depth perception may be because you're suppressing when you're not supposed to, this portion is maybe because you're not suppressing when you are supposed to. So when you're walking past a busy crowd, for example, you should be able to suppress the movement beside you. At a grocery store, the aisles beside you. If you're not able to, you may feel overstimulated, like there's too much noise around you. And to be able to control what you do and do not suppress, this is called central peripheral integration, meaning you're able to integrate what you see in the world in front of you and the world around you. So if you find yourself avoiding crowds or unable to tolerate visually busy places, it may be due to that poor central peripheral integration. Now, if you find that your reading comprehension is poor or you can't remember what you're reading quite as much, it may be due to two things: eye tracking and visual memory. So eye tracking, that's how your eyes are moving back and forth to read a sentence. So if you find that you're reading a sentence over and over again and you're not understanding it, it may be that your eyes are jumping around or you're rereading things, you're going backwards, you're going forward. They're not going as linear as they used to. Now, visual memory, that's your ability to translate what you saw with your eyes to store in your brain. So say you were able to read something from a grocery list at one point, and then you know the next three things you're supposed to get, and now you keep having to read even in the same aisle. that may be poor visual memory. You can't translate what you were able to see on paper into your brain and then go to that next step of finding what you need. Overall, we can categorize these changes that happen after brain injury as anatomical changes or sensory changes. So after a certain amount of symptoms checked off, if you do pass that threshold, we go into the exam and we try to search for the things that have changed. Now, things that we can see would be anatomical changes. Things that we can't see as much are usually sensory changes. So anatomical changes can include things like visual field defects, nerve paralysis, to name a few. Sensory changes are muscle weakness, processing defects. So a visual field defect, that would be something like this. So if your visual field would take up in each eye, say this is the right eye and this is the left eye, you could be missing an entire half of vision. This would be called left neglect in one eye, or an entire half of vision in the other eye. Now, you may be able to see these portions right here, but if you notice that you're bumping into a portion of the wall more than the other, it could be that this entire visual field has disappeared. And that could be due to an atrophy of the optic nerve fibers. Now, if you're seeing everything you need to, but you can't process things as much, that could be more of a processing deficit. So I'm going to give you a few seconds. If anyone is brave enough, I would like you to unmute your microphones and tell me what you think this could be. But now I'll reveal this. I'm sorry I had to torture you, but I did draw it out, and she did an amazing job describing all of that. But here it is. Hopefully this has you seeing it a little bit more easily now. So these are the ears in the red here. You can see the yellow, that's the outline of the face. These are the eyes in green. This is its little snout here in blue. And then this is the body. Awesome. So not only from this do you have to be able to visually process and put everything together with what Camino was describing, then you have that auditory processing as well. And now this with the outline just makes it a little bit easier. Okay, so that kind of shows how even with a picture, even if you're seeing 20/20, you have to be able to process everything to put that whole picture together. So let's dive a little deeper into what is included when we are trying to check for all of that, trying to check for how well you're seeing, your ocular health, see if there are any defects in the visual field, and see how that processing is. So to better understand what occurs in an eye exam or in specifically an ABI vision assessment, we look at three big things. There's the refractive error, we look at the ocular health, and we look at the binocular vision. So we'll break it down. Firstly, with the refractive error, that's the most important first step, is to make sure that you still are seeing that 20/20. So we need to make sure that the eyes are seeing well. If you need a prescription, you're wearing the correct glasses. As I mentioned before, your tolerance becomes much lower after a brain injury. If you were able to tolerate a prescription that was a little bit off before, you certainly will not be able to now. So the first step is to just make sure your eyes have the tools they need to see properly. If you're straining in order to see, you're using a lot more muscle and energy than you can currently spare. So this is bound to trigger some headaches. The second step is to ensure the health of the eyes are in good shape. This means that we need to see if the trauma of the brain injury caused any physical damage. So we need to dilate the eyes to make sure the retina is still attached. We need to see if there was any optic nerve damage that may have damaged the peripheral vision or the side vision. We want to know if the front of the eyes itself got scratched. Now, most of these injuries will present very early on. So, for example, a corneal abrasion would cause a lot of sharp pain in the beginning, and a retinal detachment would cause blindness in the first few days or weeks if not resolved. And this would usually come with symptoms of flashing lights, floaters, or a curtain veiling over the eyes, closing over the eyes. So if you're listening to this and you're wondering if this could be you, chances are you can probably relax. Most of these things that are vision threatening are usually immediately ruled out, and they'd happen pretty quickly. If the eyes are still experiencing pain or aches after a longer amount of time, we have more time to investigate, and there are more things that we can do to investigate. So in the same scenario, if you're not seeing anything picked up in that first exam and you're feeling exacerbated because maybe your symptoms haven't been validated, this is where we need to go deeper. Okay, so dry eye is one of those things that is kind of hard to really tease out. Dry disease is a multifactorial disease, meaning that there are many causes and also many symptoms. It usually is a slow burn, but it may seem more sudden because, as we said this before, your tolerance becomes lowered. So if you're having persistent pains in your eyes that can't seem to be explained by anything else, it's good to have a check for the dry eye disease. There are glands that you have in your eyes that if they're not functioning properly, they can actually atrophy if they're not working. Those glands can die off, and it's very difficult to either refill them again and impossible to bring them back at all. So a very important thing to assess. Now we talked about the physical issue, but the binocular vision goes into more of the neurological issue. And these are the things that are really hard to see. So we're going to break that down even further. So the systems that need to work in order for you to see, that includes eye tracking, eye teaming, focusing, sensory fusion, visual information processing, and visual motor integration. If any of these systems malfunction, it can give your eyes great discomfort, and not being able to read properly or judge depth properly. A breakdown in one or all of these systems can cause a lot of issues in your day-to-day functioning of your vision. Now, first, eye tracking, very important for reading. It's also important for hand-eye coordination, such as catching a ball, or reaching and grasping, such as when you're cooking. Eye teaming is important to keep images single. So if you're seeing double, it'll become hard to drive. It'll become hard to read. It'll become hard to see faces. The focusing system, that's you're looking near to far. So the focusing system is very similar to like a camera changing focuses, zooming in and zooming out. So if you're in a classroom, for example, and you're looking at the board to see what the professor is saying, and then back at your notes to copy things down, that requires a lot of immediate focusing. And that zooming in and out usually happens really quickly. So your eyes, or the lenses in your eyes, usually relaxes for you to look far away and then scrunches up for you to look up close. So that far, near happens in a snap second, very quickly, normally. In a boardroom, when you're trying to read your notes and look up at your colleagues to share your thoughts, think about that again. You're scrunching up to read your notes down here, then you're looking up to look at a colleague. That happens really quickly, really automatically. Or when you're in the office and you're looking at your computer, then someone says hi from across the room and walks towards you. All of that happens usually very quickly and automatically, that focusing from near to far, because the fibers and the muscles in the eyes are very flexible. As we age, we do lose this elasticity, which is why reading glasses need to be worn. But in a brain injury, this loss of flexibility can happen much more rapidly and much earlier. It can also happen asymmetrically in one eye more than the other eye, so that can be very confusing as well. And it also really disrupts kind of your looking near to far, because all of that happens a lot more slowly and it's not as consistent either. You could be okay one day, not okay the next day, it can cause headaches one day, be fine the next day. So even if you're able to do it, it may need a lot more energy, and that can cause a lot of invisible or unseen symptoms, such as those headaches or just avoiding work, not wanting to work, not needing to work. Now, sensory fusion, that's your depth perception. So driving and seeing the car in front of you, again, stairs, seeing that next step. Sports, say in soccer, you need to see how far your opponent is so you don't run into them. You need to know how far your teammate is so you can pass them. You need to know where the goal is so you can score. Now, visual information processing, this is putting everything together, basically. All the things that you received from your eyes, gets processed and put into your brain. This is something that definitely can't be checked in a regular eye exam. The regular eye exam focuses on what the eyes are seeing and if they are healthy. Basically, what the eyes need to just baseline survive. The visual information processing is what goes on after the information leaves your eyes and goes to the brain. So for example, let's say going to that grocery store. You're walking into the grocery store and everything seems too noisy, like there's too much movement at your sides, there's too many colors, words, lights, people. It may mean that your brain is not able to make sense of what your eyes are seeing around you. This is part of figure ground or that central peripheral integration. Another common challenge after brain injury is just remembering where you buy, what you need to buy, or when you need to get to the grocery store. Whenever you leave the house, you always remember phone, wallet, keys. After a brain injury, that may be a harder thing to remember, that phone, wallet, keys. This is called sequential memory. Now, I'm going to show you one of the ways that we test for sequential memory. So I'm going to show you some shapes, okay? So usually we would have you look at the sequence of shape for 5 seconds. So I'll give you 5 seconds to memorize this. And then I'm going to show you a list of other ones. And I want you to try write down on your phone or a piece of paper, see if you can memorize it. Okay, so we can count. A little more than 5 seconds there, but you can pop it over here. Now, whichever one you think, I want you to write it down, commit to an answer. And if anyone's feeling brave again, would you be willing to unmute? Let me know what you think it is.
Number 1.
Ding, ding, ding. You got it. So as we go on, this does ramp up in difficulty. Thank you so much for that, by the way. It's scored on a bell curve based on what should be expected for your age. So it'll start at 2, then we go up to 4. The longest, I think, is a sequence of 8. So it's really looking at if you can memorize kind of things in a sequence, right? Like if you're going to say, do a pickup after school for your kid, right? You think of, you have to go get them, take them to soccer practice, then it's groceries, then it's these errands, and it's that errand. There's all these different things that you have to remember in sequence. So sequential memory is very important to day-to-day functioning and something that can be very interrupted after a brain injury. So the visual information processing, we look at a variety of different things. This is just one of the things that we look at. There's also visual discrimination, figure ground. I believe we'll talk a little bit more about it later on as well. As we progress through vision therapy, this is something that we continue to assess as well, all the different types of visual information processing. Now, while it's nice to have these objective measures, the best way and the best payoff is really when you realize that you're having an easier time remembering that grocery list, or you've left the house without forgetting your wallet. And these are the little wins that we really truly like to measure with when we think about your progress through therapy. Now, looking at the next part is visual motor integration. And this is another way that we put all the things together. So for example, when you need to copy a sentence, just simply, you need to see the sentence, translate it into motor movement, and then move your fingers onto the paper to copy the sentence you just saw. So it sounds like an easy process, but it can be very difficult because of all the different things that are involved. Without the system working, that can be very difficult.
Can't hear you.
Let me know throughout too if there are any questions. We can absolutely stop and answer along the way as well. I would love to make this more interactive. So any questions, just let me know. So visual motor integration, that's what happens when you put it all together in terms of your vision and your motor. So let's talk about that sentence copying again. You need to see the sentence, then you need to translate it into motor movement, and that's when your fingers are moving on the paper to copy the sentence that you saw. So without that visual information, that visual motor integration happening, that can be very difficult to do. Okay. So say if you're cooking, this may be difficult too if that system isn't working. So you're following a cooking video, you see what they're showing you. You see that they're showing you to fold some dough. But if you're not able to translate that, what you're seeing to your hands and what you do, there may be an issue with that visual motor integration. So it seems simple when I say it and describe it, but really there are so many things that have to go right to perform just these simple tasks, writing and cooking. It's really a miracle that we can ever see and do anything at all, but those are all the things that are required. All right. And that's really the perfect segue because now we're going to talk about how we can rehabilitate all of that stuff. So we're going to go into 4 options. The first thing is task glasses. Okay. This is the easiest thing because it's just kind of putting on glasses and that helps part of it. Okay. So the glasses that we normally put on are for distance, for far distance. You know, if you can't see far away, then you use glasses to see that. Okay. But as I said before, a visually healthy system has the ability to focus like a camera. So it can lock onto things at a far distance and then at near with that easy flexibility. Aging can cause a reduction in this flexibility, and this is normal, but there is still typically a range of flexibility for far and for near. So after that brain injury, this can either happen more rapidly and or your ranges become much tighter. So maybe you could wear glasses for far away and then just for up close at a certain point. And now you need glasses for computer as well, because that focal distance can be a whole different beast and a whole different set of flexible of muscles flexing at that distance right there. Now, you may also need different glasses for reading, things that are up close at night as well. A lot of times we can go into progressives that may have all of them, but if your tolerance is lowered and you can't you can't move your eyes here for distance, here for computer, here for up close, you may need 3 separate glasses to give you that ability to move your eyes around as much as you need to until you can kind of learn where you need to look through things again. And they can be task specific as well. So if you're having a harder time seeing at night, specifically driving at night, you may need different glasses to cut out the glare and vision that is better for nighttime driving. You may need different glasses if you enjoyed woodworking. So that's a little bit farther than the computer distance from your eyes to a workbench. Or knitting glasses, which tends to be a lot closer. So all those things need to be considered for your day-to-day to give you the tools that basically help for your hobbies and the things that are important for your healing, the things that you enjoy. Now, there are also prism glasses that can help with the doubling vision. Now, ideally, with doubling vision, we want to be able to rehabilitate that and make it so that your muscles are stronger and can work on their own. But if that is happening either too slowly or we need some support, if the doubling is too wide, we may need to bring them in a little bit so we can work on some of those ranges and build that range up. You may need to wear a prism. So there are 2 different types. There are either ones that will help to support your eyes, just kind of bring them in, and ones that help to challenge you instead, so make it harder. And sometimes in therapy, we try to make it harder, throw harder prisms at you so you can build up that threshold. Okay. Now, the different ways to deliver the prism include temporary prism or grounded prism. So the temporary prism are these lines right here, the Fresnel prisms that we just stick on the glasses, because oftentimes with therapy, the prism does change over time. Okay, usually you'll need less and less over time, or sometimes just with healing, that can kind of come down a little bit on its own as well. And sometimes if you get any stressors, say you get sick, say if there's any regression, sometimes that can go up as well. So Fresnel prisms, the stickers are usually the easiest things because we can change that out as we need to. And they're surprisingly comfortable. It looks like there are these lines, but you can actually see quite well of them. This is a picture of Hillary Clinton. She had worn them to an address, I believe, at one point. So it has been used out in presentation, out in public as well. Now, these are yoked prisms. So this is an example of the ones that we would use in office to train. Now, if it ever gets to the point where the prism we get down small enough that they are just therapeutic, they will just help a little bit, and we have worked the muscles in as much as we want to and as much as we need to, and we just need something for comfort, we can grind that into the glasses. And at that point, it would look like a normal pair of glasses. No one would be the wiser. There are also tinted lenses that exist. So Avalex is specifically a lens for migraine and light sensitivity. Now, the way that these work, they look kind of like sunglasses. Some of them can be lighter as well. They're customizable depending on what we need, but essentially they filter out the harmful wavelengths of light, such as blue, red, and amber, that can trigger a migraine. But they'll allow the soothing green light to come through, and that's usually what calms your system down. So it's very specifically studied as to what wavelengths and what uh, colors of lights can come in and what can come out. Usually these glasses can be worn before a migraine, most preferably, to prevent or reduce the risk of them from onsetting or reduce the severity of them. Now, perhaps the most effective and long-lasting way we know of how to help with a brain injury is through vision therapy. So while the last few minutes can help with a few of the symptoms, they can be crutches, while we're trying to heal and while we're trying to improve things, vision therapy really helps to bring everything together. So we have to rehabilitate the systems that were weak. To recap, these are all the systems that we need in order to have clear and comfortable vision. If that goes away, we need to figure out which symptoms have malfunctioned and then rehabilitate that system. Usually we will work on the other systems as well, because if one system has gone down, chances are some of the other ones have been knocked down as well. But we'll basically try to focus in on what needs the most help. Oftentimes, we may use one of the last lenses discussed to supplement the therapy and aid as we work through therapy, because the effects are meant to be more long lasting and the process also takes more time. So to recap, we need that eye teaming, eye tracking, focusing, sensory fusion, visual information processing, and visual motor integration. Now, visual rehabilitation, if we find out that you are a candidate, will take place weekly in about 45 minutes each week, one-on-one with a therapist in office. This is how we found is the most effective frequency as well as duration in office to make changes. Usually you'll have homework as well, about 20 minutes daily. It's always better to do less daily than it is to do a whole lot more infrequently, because this is what reinforces what you've learned essentially. Now, each time you come in for an in-office session, we look at how you've done with your homework. We look at what things have changed, what things have improved, and we will either change activities based on what you're doing, either increase the levels so it gets harder if you are doing well, or we can even bring things down. So if something becomes too difficult that you may be avoiding, we may need to break that down so that we can get more of that foundation before we move on to that therapy. At the end of the day, we are trying to reach a goal, and what we do in therapy just continues to reinforce that. So each week, we essentially look at what you need and where you need to go. So the therapy and the sessions are very customized to what you need to do. And this is why the sessions will take 12 to 18 months. And a lot of that will depend on things that we find out during the sessions. Sometimes it takes longer to adapt to what we need to do in the therapies and the sessions. It takes a little bit more time to simulate. Sometimes it's a little bit faster. So it all depends on how things are going. And every 10 sessions, we have a check-in with the doctor, so someone like myself as well, to assess all of those systems that we talked about before. We assess we look at the things like that visual information sequencing, see if the sequential memory has improved. We look at all the data points to see if those things are changing, if those things are getting better. If we are stuck on a specific spot, that's when we need to know that we need to go in a little bit deeper in therapy. So although we are looking at, with the vision therapist, how things are improving every week with the specific activities, we'll go every 10 sessions and look on the global scale and the broad scale to see how we're doing and where we need to go on to achieve our goals. I'm going to show you a few different things that we do in vision therapy. So this, for example, is a letter tracking sheet. The person is instructed to circle the letters of the alphabet in the correct order as they tracked along left to right on each line. The sheet starts out blank, and this is time, so you wouldn't see these circles here. The sheet is completed where you're circling A, B, C, etc., and you go on. If you miss any of the letters, you won't get to Z. So usually when we begin, we will often instruct patients to draw a continuous line at the left edge and then circle for the next letter when they find it. If an entire row is completed and no letters were circled, no mistakes been made. So this is just one example of the visual mechanics of reading. Now, as time goes on, if you are able to get rid of that line, it ends up being just circles like this. So you don't have to track quite as closely anymore. You don't have to look at every single letter. To go even further, you may be able to look at a broad scale, really get in that central peripheral integration, and know where you need to go right away. See that D right away, see the R right away. Just find it really easily. Without the comprehension demands of actually looking at trying to read what you're trying to understand, this kind of gibberish of letters allows us just the foundation of the eyes tracking and that motor and the vision to become integrated together first. The goal is to eventually improve the tracking skills and get that better reading comprehension as we go on. Now these cards, these are called lifesaver cards. They come either on a transparent or solid white card. And the basic instruction is hold the card at 20 inches from the face in one hand. And in the other hand, place a pen tip in the middle of any two circles against the card. Look at the pen tip, bring that towards your nose. And then slowly 4 images will appear and eventually a third circle will float on the tip of the pen. This view's third image will be a mixture of the details from each of the real circles on the card. Getting the third circle can take practice, and each line provides a different demand for teaming and fusing ability of each eye. So this shows you multiple levels just on one card. Then, to make it harder, you have to move the card up and down and sideways and in a pattern while maintaining a third floating circle. This really increases the demand. And an even harder challenge is to see that third floating circle from all 4 rows at the same time, which is really, really wild. It's very, very much like weight training. So we begin to work with the big muscles, and slowly we go down to those finer muscles. We add more and more weight on until you have the strength and dexterity to fuse your eyes. So this is an example of if you're getting that double vision or that inability to focus, this is how we can bring those eyes together. We also work on the opposite. So we also work on the eyes being able to controllably go out and diverge. So converging and diverging are both very important. Above all, the ability to control and do what you want to do is the most important. So these are just a few activities, some examples of what we use to train your eyes and your brain to work together. And at the end of the day, we really are trying to bring it to that grocery store. The goal is to rehabilitate your eyes so that the things like grocery shopping that were easy and automatic and mundane before, once again become easy, automatic, and mundane. All these things are really fun and exciting, and the goal is to make it so that at the end of the day, things that weren't fun and exciting and required so much energy become boring once more, because really that's what we want. So thank you so much for following through that presentation. Thank you so much for all of your participation. Want to leave a little bit of room for questions if we had any.